Hello, my name is Harald Rosen. I'm a surgeon from Austria and I'm happy to be the editor-in-chief of the Hamdan Medical Journal. Today I will talk about metabolic surgery. Metabolic surgery is focusing on patients who are suffering from diabetes mellitus and from metabolic syndrome, which is associated with obesity and high levels of lipids in the blood. Obesity surgery has been extremely active and has become popular by the beginning of the new millennium. Basically due to the introduction of new methods like the laparoscopic gastric banding, a minimal invasive procedure which was able to reduce the patient's weight. However, today, more than 15 years after the introduction of gastric banding, we have to confess that unfortunately the majority of the patients fail to keep their weight loss on the long term, and more than 40% of the patients see either complications associated to the band or see a regain of their weight. But parallel to the development with gastric banding, a more older procedure of the past, which primarily hadn't been feasible to be done in laparoscopic surgery, is now standardized, done also on the minimal invasive level, and this is gastric bypass. Gastric bypass is also focusing on reducing the volume of the stomach, but additionally part of the absorption of the calories in the small bowel is also reduced. So it's a combination method of volume restriction and malnutrition or malabsorption. Interestingly, it has been shown that patients with type 2 diabetes, which is mainly associated with obesity, lost their diabetes rapidly following gastric bypass procedure, even before the weight loss started. So this interesting observation led to many hypotheses how this may work. And right now we really don't know the clue and the real explanation why this method is so active in treating diabetes. Right now we have recently 2 publications in the New England Journal of Surgery, which were issued this year, showing that 2 randomized studies comparing obesity surgery versus standardized conservative treatment on the highest level possible in order to treat diabetes type 2. One publication comes from the Cleveland Clinic and shows that patients who had been treated by gastric bypass or by a newer method of volume restriction, the so-called gastric sleeve resection, were treated highly significantly better in terms of losing their diabetes than those who were not operated at all. Another study, also prospectively randomized controlled study, which came jointly from Italy and New York, showed that even patients with a lower degree of obesity, that means with a body mass index below 30, were treated successfully against their diabetes by obesity surgery and significantly better compared to those who only got conservative treatment. So these 2 studies can be regarded really as milestones in the treatment of diabetes type 2, as they show really nicely and on a high significant level that by surgery be it by bypass surgery or even by just restricting the volume of the stomach, diabetes mellitus can be controlled in a very fast way. So it comes, of course, to the question of complications when we talk about surgery. Right now, international studies and also these two papers show very nicely that in experienced hands, the complication rate is below 1%, comparable to complication rate in cholecystectomy or other easier procedures. So we have here a method which seems to be now, on the short-term level, of course, as we don't have any long-term observations until now, able to control diabetes so that these people do not take any medication at all after a certain time. And taking into account that within the last year the number of diabetic patients in the United States, for example, has triplated, this is a very important message to the medical community. So take your time and get the second issue of Hamdan Medical Journal, which will come out in August this year, or have a look on our website and see what's new on diabetes mellitus treatment. Thank you very much for your attention.